Greetings, future colleagues. In this video I will demonstrate a scrubbing technique to be used before surgery. And in the next one, gowning and gloving are shown. I am currently standing in the scrubbing area between operating theatres. I am wearing clean scrubs, clean shoes and a surgical cap. Normally I would be also wearing a mask and, if necessary, eye protection. But for the purpose of this video I decided against it, so you would be able to make out what I'm saying. We have to have made sure by this point that our fingernails are the appropriate length. They should not extend beyond the fingertips. Also, jewelry must be removed. We start by cleaning the underside of the tips of our fingernails using a nail pick and a scrub with soap. This is done before the first surgery of the day and usually does not have to be repeated afterwards. When it comes to the actual scrub, several different surgical scrubbing techniques can be used. What I'm about to demonstrate is just one of them. The goal of them all is reducing the amount of resident microflora on our hands, but it is impossible to achieve sterility. It may be somewhat helpful to compare this procedure to the preparation of the operative site of a patient, where we start scrubbing at the planned incision line, which has to be the cleanest, and then work our way peripherally. So the fingers and palms of our hands should be the cleanest in comparison to the wrists and forearms. Therefore, I suggest starting with the fingertips and always working our way towards the elbow. The whole procedure should last approximately 5 minutes. We start by wetting our hands before applying soap. It is important to keep our hands above our elbows at all times, allowing water also to run towards our elbows, not the fingers. In case of not owning an automatic soap dispenser, in order to avoid contamination of our hands, we have to use our elbow to administer soap. I begin by rubbing the fingertips against the palm, repeating this process on the other hand. Then I proceed to scrubbing each finger individually. After this, I work the spaces between my fingers. Followed by the backs of my hands. I will continue rubbing my hands together like this. And then moving on to wrists and forearms. Keeping in mind, always working my way towards the elbows. Having almost reached the elbow, I will stop and switch to the other hand. Now it is time to rinse the soap off my hands, again making sure I am keeping my hands above my elbows. I will repeat the same process 3 times. The only difference being that during the final, third time, I'm going to stop at the wrists in order to minimize the risk of contaminating my hands with microorganisms from my forearm. After having spent approximately 5 minutes washing our hands for 3 times, it is time to dry them and then perform antisepsis. Now, while drying my hands, I will explain the most important thing to keep in mind when it comes to surgical scrubbing. So, please keep this in mind, it is of critical significance. Anyway, after having dried my hands, I can now apply the antiseptic. Again, using my elbow. I advise spreading the solution similarly to the order used during the initial scrub, but not going further than the wrists. No rubbing is necessary at this point. 30 to 60 seconds is the appropriate time to wait for the antiseptic solution to take effect. Then some surgeons like to repeat antisepsis once more for the same 30 seconds. Or we can move on to gowning and gloving.